Welcome to the Deep Dive. Today we're tackling something, well, pretty significant in canine health. Mammary gland tumors in female dogs.
That's right. Yeah, a really important topic. We've been digging into a resource called Canine Mammary Gland Tumors, which gives a really solid overview.
And our mission today, really, is to pull out the key stuff for you. Why do they happen? How do we spot them? And importantly, what can be done?
Exactly. Trying to make it clear and digestible.
Okay, so let's dive right in. What are canine mammary gland tumors, basically?
Well, in simple terms, they're growths. Growths in the mammary glands of female dogs.
Right.
And these can be benign, so non-cancerous, or they can be malignant, which is cancer. It's really a spectrum,
A spectrum from harmless lumps to, well, much more serious stuff.
Precisely.
And my understanding is they're, incredibly common. The source had some pretty stark numbers.
Oh, they really are. Very common. Mammary tumors make up something like 50 to 70% of all tumors in female dogs.
Wow, 50 to 70%. That's huge.
It is. And it gets even more specific for certain breeds. Like beagles, female beagles, the source says around 71% will get at least one mammary tumor.
71%, nearly 3/4 of beagles. That definitely underscores why we need to talk about this.
Absolutely.
Okay, so we know what they are, how often they appear, but what's going on underneath, biologically? Why do they develop?
It's complex, but hormones are definitely central players. Estrogen is one.
Right.
It seems it can have what are called genotoxic effects.
Yep.
Think of it like potentially causing direct damage to the cell's DNA in the mammary tissue.
So direct damage to the sort of instruction manual of the cell.
Kind of, yeah.
Yeah.
It might introduce errors, basically.
Okay, and what about the other main hormone, progesterone?
Progesterone seems to work a bit differently. It's thought to boost growth hormone levels and also the receptors for it right there in the mammary gland.
Okay.
And that could lead to more of something called IGF-1, insulin-like growth factor 1.
IGF-1. And that does what?
Well, IGF-1 is linked to cell proliferation. That just means cells multiplying and their survival. So progesterone can kind of create an environment where cells are encouraged to grow and stick around.
So estrogen might damage the instructions, and progesterone helps fuel the growth.
That's a reasonable way to think about it, yeah.
The source also mentioned this term, field carcinogenesis. What's that about?
Yes. That's a really key idea here. Because the dog's entire mammary tissue, the whole chain, gets exposed to these hormones, right? Through puberty, heat cycles.
The whole system.
Exactly. So if the conditions are right for a tumor in one spot, they're likely similar elsewhere along the chain.
Which explains why finding multiple tumors is common.
Very common. About 70% of cases involve multiple tumors. It's not usually just one rogue spot. It's more like the whole field is susceptible.
The whole landscape, right? Okay.
Yeah.
And building on that system-wide influence, obesity. How does that factor in? This was interesting.
Yeah, it is. Obesity can increase the risk. Fat tissue isn't just inactive storage. It actually affects hormones.
How?
It can lower levels of a protein called sex hormone-binding globulin. This protein normally grabs onto estrogen in the blood.
Okay.
So if you have less of this protein, you end up with more free estrogen floating around. And as we just said, more estrogen can contribute to tumor development.
So keeping dogs lean isn't just good for joints and hearts. It might help here, too.
It's another piece of the puzzle, definitely.
Okay, let's shift focus slightly. Who is most likely to be affected? Are there clear risk factors?
Age is a big one. These tumors are pretty uncommon in dogs under 5.
Right.
The risk really goes up as they get older. The average age for malignant or cancerous ones is around 9 to 11 years, maybe slightly younger, 7 to 9 for the benign ones.
So definitely more of a middle-aged to senior dog issue, generally.
Generally, yes.
And what about breeds? You mentioned beagles, but are there others particularly prone?
Yes, the source lists quite a few. Let's see. Toy and miniature poodles, Springer Spaniels, Brittany Spaniels, Cockers,
Okay.
English Setters, Boxers, Pointers, German Shepherds, Maltese, Dobermans, and Yorkies, too.
Wow, that's a real mix of sizes and types. Makes you wonder about genetics.
It does. If you own one of those breeds, it's definitely worth being extra vigilant and talking to your vet.
Good point. Now, there was a surprising finding about weight, but early in life.
Yeah, this was counterintuitive. Being underweight between 9 and 12 months old seemed to offer some protection against developing these tumors later on.
Underweight, that's not what you'd expect.
No, it's not. It just shows how complex biology is and how early life factors can have these long-term echoes.
Absolutely. And location-wise, do they tend to pop up in specific glands more often?
Yes, the caudal glands, the ones towards the back near the tail, seem to be affected more often than the cranial ones up towards the head.
Okay, rear gland's more common. Got it. So we know who's more at risk. How do we actually spot these? What signs should people look out for?
The classic sign is feeling a lump, usually a discrete, pretty well-defined lump in a mammary gland.
Just a...
Often, yeah. And frequently, the dog seems perfectly fine otherwise. Healthy, happy. Just with this new lump. And remember, finding more than one is common, that 70% figure again.
So regular petting, feeling that area is probably a good idea.
Definitely a good habit. Gentle palpation.
But there's a more aggressive type mentioned too, isn't there? Something different.
Yes, inflammatory carcinoma. That one's unfortunately much nastier.
How does it look different?
Instead of a neat lump, it's often more like diffuse swelling. The whole gland, or even the whole chain, might be swollen, red, warm to the touch, and painful.
Ooh, sounds uncomfortable.
It is. And sadly, this type is often linked with metastasis, the cancer spreading, and it can make the dog quite sick systemically. Lethargy, poor appetite, that sort of thing.
And the outlook isn't great for that type?
No, the prognosis for inflammatory carcinoma is generally poor.
Oh.
Recognizing those different signs is crucial, though.
Right. So any lump, any swelling, redness, pain in that area, get it checked.
Absolutely. See a vet as soon as possible. Early detection is always, always better.
So what does the vet do? How do they figure out what's going on with a lump?
Well, a common first step is something called a fine needle aspirate, or FNA.
Okay.
They use a really thin needle to suck out a tiny sample of cells from the lump. Then those cells get looked at under a microscope. That's cytology.
And does that tell them if it's cancer?
It can give a very good indication. The source says FNA cytology matches the final diagnosis pretty well, with good sensitivity and specificity for malignancy.
But maybe not the final answer.
Not always definitive.
Yeah.
For that, you usually need histology. That means taking a small piece of the tissue itself, a biopsy maybe during surgery to remove the lump, and looking at the structure of the tissue, not just loose cells. That gives the most complete picture.
Okay, FNA for a strong clue. Biopsy for the definitive diagnosis. What about looking elsewhere in the body? Imaging.
Yes, that's important for staging, figuring out if the cancer is spread.
Right, metastasis.
Exactly. Chest x-rays, thoracic radiographs are standard to check the lungs, as that's a common place for spread.
Lungs.
CT scans are even better, more sensitive for spotting tiny lung mets. And they might also do x-rays or an ultrasound of the abdomen to check lymph nodes there and other organs.
So checking lungs and belly for any signs of spread. Makes sense. Okay, so you have a diagnosis. What are the treatment options?
Surgery is really the main treatment. Getting the tumor out surgically and doing it early gives the best shot.
What kind of surgery? Just take the lump out.
It depends. Sometimes it's a wide excision, the lump, plus a margin of healthy tissue around it. Other times, especially if there are multiple tumors or it's a larger one, they might do a chain mastectomy.
Removing the whole chain of glands on one side.
Or even both sides, yeah. Depends on the specific case.
Okay. What about chemo? Does that come into play?
It can, yes. Chemotherapy is usually considered if there's a high risk that cancer might come back or has already spread.
Like for those high-grade tumors you mentioned?
Exactly. High-grade tumors, or if the biopsy shows the tumor cells got into blood vessels or lymphatics, or if the cancer is already at a more advanced stage. Got it. Now, spaying, ovariohysterectomy. We know it prevents lots of things, but how does it connect here?
Oh, it's hugely important, both for prevention and potentially for treatment outcome.
Okay, let's break that down. Prevention first.
Right. Spaying a dog before her first heat cycle. It cuts her lifetime risk of getting mammary tumors down to just 0.5%.
0.5%. That's almost eliminates the risk.
It's incredibly effective. Even spaying before the second heat is really good, drops the risk to around 8%.
Still a big reduction.
Huge. But, interestingly, spaying after the second heat, or once the dog is older, maybe past 2.5 years old, it doesn't seem to offer much protection against future tumors developing.
So the timing is really critical for prevention.
Very much so. But there's also a potential benefit around the time of treatment.
Oh.
Yeah, the source suggests that spaying within 2 years before removing a tumor, or doing it at the same time as the tumor removal surgery, might actually improve the dog's survival chances.
That's fascinating. So even if a dog already has a tumor, spaying could still help the outcome. It seems possible, yeah. Worth discussing with the vet.
Absolutely. Those spaying stats are really powerful. Okay, after treatment, what tells us about the dog's likely prognosis? What factors matter most?
Several key things. Tumor size is a big one. Smaller tumors, removed completely, generally have a better prognosis.
Smaller is better. Makes sense.
Whether the cancer has spread to the nearby lymph nodes, that's a really critical factor. Lymph node involvement usually means a poorer outlook.
Okay.
And the overall clinical stage, which combines size, node status, and any distant spread, is a major indicator.
And the type of tumor, you mentioned inflammatory carcinoma.
Right. The specific type matters too. Mammary sarcomas, which are less common, and inflammatory carcinoma definitely have a worse prognosis generally than many of the more standard mammary carcinomas.
So ideally, you catch it small before it hits the lymph nodes, get it removed completely, and hope it's not one of the really aggressive types.
That's the best case scenario, exactly. Early detection and complete surgical removal are key.
Okay, let's just quickly circle back to prevention one last time. Early spaying is obviously the heavyweight champion here. Anything else?
Well, like we touched on with obesity, maintaining a healthy weight seems sensible. Potentially reducing that free estrogen, especially important during puberty, perhaps.
Right.
And, of course, regular vet checkups and being familiar with your dog's body so you notice lumps early.
Diligence and vet visits. Okay, so wrapping up our deep dive here. Canine mammary tumors are super common, linked heavily to hormones. They range from benign to very aggressive. Early detection feeling for lumps is vital. Vets use things like needle aspirates and biopsies to diagnose.
All right.
Surgery is the main treatment, maybe chemo sometimes. And spaying, especially early spaying, is just massively preventative.
That really covers the key takeaways from the source, yeah.
A good summary. So for you listening, hopefully this gives you a much clearer picture of this really common issue. It just emphasizes how important proactive vet care is, those regular checks, and, just knowing your dog's body. Maybe take a moment to think about the info, especially about spaying, and have a chat with your own vet about what makes sense for your dog to keep them as healthy as possible.